Hello everyone, this is Dr. John Makoff. I want to talk about a couple cases I had last week that I thought were pretty interesting. They were actually, well, mostly both like low back issues, like disc issues. And first was a new patient. He came in a little shifted with his upper torso and was referred to me by another patient. And we went over some of his history, and he said he keeps getting these disc issues, these low back issues. This one was the worst, but over the years, it has been progressing. So if a disc issue is really treated well, it really shouldn't come back. If you take a look at all the issues around it, it really shouldn't come back. And we went through some of his history. He's a smoker, and some, intuitive alarms went off, and I started to assess some of his muscles that deal with heart. So his grip strength, some of his internal rotators of his shoulders, and they were all off. They were inhibited. So I checked them against certain physiological reflex points versus emotional reflex points. And the physiological points, turn those muscles back on strong, which indicates to me that there was a heart issue. Then I just also checked like some emotional points, and those didn't turn anything on. They stayed inhibited. So we talked that there's likely a heart component, at least, to the issue, and trying to explain to him as well as maybe to you, is your body is an amazing being of different sources, but it also really wants you to survive. So if you can imagine, if your heart is slowly getting compromised, and smoking does inflame the system, which can cause more plaquing, which can cause more compromise in the arterial flow. And if your body doesn't stop you or slow you down, you have potential to have heart issues, heart attack, infarction, stuff like that. So the body's an amazing, I don't even know what to call it. It's amazing. So it slows you down sometimes by giving you back pain, because if you have back pain and debilitating back pain, you can't overly push yourself to the point of having a heart attack. So we tried certain things. We did some rehab for his heart using some quantum neurology technique, and we also gave him some exercises. But I actually had him try to just for me to see him to try to stand up straighter. Wasn't budging that much without really forcing it. I have various herb test kits from certain companies, and I gave him one that dealt with specifically heart that I had a feeling that might help him. And he just held on to it, and he was able to straighten up a lot more just by having that in his field, just by having that energy of that herb around him. So I'm like, okay, I think you're going to need this herb to help with the heart issues while we work on other things. So that was just the first appointment, and not going to even say that he walked out all straight with this one, because this has been building up for over years. But we'll see him again hopefully this week, and get him onto the road. But it's just that the concept of what is the back pain really coming from, and sometimes it is right from the back, and that's from a poor stabilization system, poor support, and it can be very structural, and a lot of structural exercise will help with it. But if it keeps repeating and you've had various treatments prior, then there might be another component. Which brings me to the next case. Another low back patient. slightly shifted, not as much as the first one. And I hadn't seen her for a few years. And so this is recurring again, a back patient. So I went through doing certain things for her sensory system rehab using quantum neurology again. Went through certain muscle, seeing which ones were inhibited. They're called myotomes, but seeing which ones were inhibited that really contribute to her core stabilization, for her lower body to work, and worked through a lot of that, and it improved a lot. Next session, she still felt improvement, but still stuck, and we worked it through some other things. But as I was checking her sensory system, which is pain, light touch, deep pressure, compression, vibration, proprioception, which is movement ability, and form recognition is another aspect of it, and temperature. As I pushed down on her spine, it all felt good and strong. Nothing shut down. I had an intuition, and I asked her if we can try pulling up with my hands below her buttocks and pull up, and to see if that changed things. And she was okay with that, and we did, and it totally shut her body down. So it had to get me thinking, okay, what shuts the body down, inhibits the body, and causes this pain from down up, not from the feet, but from the pelvis, but not as well from the weight of gravity and the body down. And for that, I had an intuition again, and I was like, did you ever fall on your tailbone? And she's like, oh yeah, years ago. And that's where some of my back pain started. So I had an idea of checking her for some concussion syndromes that happen from tailbone impact. And she had it. So as we started to address that, her improvement got even better. Smoother movement, less pain, more concentration of the pain, which is, as your body's healing a disc issue, it should what's called centralize, which means instead of going outward down the leg more or more widespread, it goes more towards the center of where the injury originates. And as we work through using certain concussion protocols that I know that I adapted to the coccyx, to the tailbone, as well as some quantum neurology, it just progressed a lot better. She also said, well, while I'm here, I also have this tennis elbow thing. And she did that 2 sessions ago, or not this last session, the session before. And I said, okay, let's take a quick look. So I stimulated the elbow that was the problem in the wrist. And because I think it, sometimes you have some neck issues that cause it. Sometimes you have direct elbow wrist issues that cause it. And sometimes other things cause it. And this was one of the other things. So it stimulated, and I started to ask the body using some muscle testing and questioning, was it a structural issue? And I was getting a no. Then we went to emotional issue, and I got yes. And so we went into that, which went into some grief of a recent loss of a parent and other things. And we followed that using some neuroemotional technique. And this last time she came in, she's like, I don't know what you did. It might be witchcraft, but it was all better, and that's weird. But it's like when you find the source of what's causing the issue, you resolve the issue. So hope that gave you a little insight. Hope that widened some perspectives and a holistic way of seeing things. And I hope everyone have a great day.